Hello, Gila River. This is Roberto A. Jackson. I told you I'd be back bringing you some very important information. So I hope you guys are ready to hear from Gila River Healthcare CEO, Dr. Anthony Santiago. And then we have a special guest. Well, I don't even know if special is fit to describe this next gentleman, of course, because I'm talking about Governor Stephen Roe Lewis. So we'll just kind of give you the floor and let you go over some of this stuff because I know you're anxious to communicate to all the viewers out there in GRBC land. Governor Lewis.
As of this last Friday, I came out with my latest executive order, number 14. And this was in consultation with my COVID task force, with all of the subject matter expertise that we have in the community, Gila River Healthcare, Tribal Health, working with all of our first responders, our departments, seeking all of their guidance. We have, under the new executive order, a 50-person gathering limit. So gatherings of up to 50 people are allowable. Masks now are required only within tribal government buildings and our community schools throughout the reservation within our community. And schools are reopening with approved plans. District 7, Maricopa Christian School, their plan has been approved. Gila Crossing Community School, their plan has been approved, and they were the first school to have an approved plan over three weeks ago. Casablanca Community School, their plan has been approved, and Blackwater Community School, their plan has been approved as well. So we want to congratulate those schools for those approved plans, and we will continue to work with especially the two committees, Education Standing Committee and Health and Social Standing Committee. We'll continue to work with the other two schools, St. Peter's Indian Mission School and the Sackatoon schools as well, to approve their plans when they are ready and when they've satisfied all of the areas needed for approval. And as always, getting vaccinated is still encouraged. If you have not gotten vaccinated yet, please consider to start to get your shot. We still have the incentive, and the incentive runs until the end of this month to get the $500 incentive. So please, still, if you haven't gotten fully vaccinated yet, please get it.
Anything you want to add to Governor's comments? I know you have a lot of slides and information you want to share as well.
Sure. No, thank you, Roberto. Thank you very much, Governor. And as Governor Lewis said, we are across this entire time, we have been incredibly purposeful and focused on safety, but also on best practices. And a lot of best practices have come out of this. And I dare say many things that are going to benefit both healthcare specifically, but the community at large, have happened because of the COVID experience. We have some art cards. And when we take a look at that, out of those nearly 8,000 cases, 1,084 of them have been hospitalized with COVID. That's a rate of 13.6%. I want to point out that for Arizona, the rate is only 5%. The fact is that our patient population, which is overwhelmingly made up of the community and people that reside here within the districts, at least 60% of the patients we see, that they do have other health issues that put them at risk if they contract COVID, such as diabetes, which is a marker for having a more severe disease. But another important fact is that out of those 1,084 adults that have been hospitalized, 987 of them, or nearly 92%, were unvaccinated. Our unvaccinated hospitalized rate for an adult is 19.7%. That is an exceptionally high number. It's nearly 4 times the state rate for hospitalization. Hospitalization is directly based on this. And in addition, fatalities. We have had 264 adults who have passed from COVID. The fatality rate for an adult who contracts COVID is nearly 5% here at Gila River Healthcare in the community. And that is exceptionally high. And so people often say, why should I get a vaccine? Because I've heard that if you get the vaccine, you may still contract the illness. And that's actually true. Out of the nearly 20,000 individuals who have received at least 2 doses, at least, we have had 2,974 who have later gotten COVID. That's a rate of about 15%. 15% of the people who received vaccines still got COVID. And in fact, that's almost 23% of all of our cases. That nearly 3,000 people is 23% of all of our cases. But what's happened to them is dramatically different. You know, out of those nearly 3,000 people who were vaccinated, only 97 of them had to be hospitalized. That's a rate of 3.3% compared to the unvaccinated who got COVID at nearly 20%. Out of those 97 adults who were vaccinated who got hospitalized, only 15 of them were people who actually received 2 doses and a booster that received a 3rd dose. In fact, the rate of people who were vaccinated who got 3 doses and got hospitalized is 0.5% compared to the unvaccinated adults who contracted COVID and had to be in the hospital of nearly 20%. This is our data. This is not the CDC. This is not Arizona Department of Health. This is 2 years of data here at Gila River Healthcare. And as hard as it is to talk about, I need to talk about deaths related to COVID. I just talked about the fact that we've had 264 adult deaths here. And again, 246 of them were in unvaccinated adults. When we take a look at those, again, nearly 3,000 people that had COVID after being vaccinated, only 18 of them have actually passed from it. That's 0.6% of those that had a breakthrough infection. And again, only 18 of the 264 deaths were people who had received at least 2 doses of the vaccine. We have had only 3 deaths in an adult who received 2 doses and a booster. People who received 3 doses of a vaccine and later got COVID, only 3 of them have died. That means 261 of our deaths were in people that received less than 2 doses and a booster. If you are an unvaccinated adult who contracts COVID, you are 90 times more likely to die than an adult who received 3 doses, even though they later contracted COVID. Remember, this is our data. This is our data over the last 2 years. So it's all about vaccinations. And I know that governor spent a lot of time, and appropriately so, on what we have done as professional teams, whether it's community leadership in government, all the various departments, Gila River Healthcare, from our board to our staff that are down there on a daily basis. Everyone is doing their part, but that doesn't mean that people can't take their own individual responsibility. It's all about being vaccinated. If you're vaccinated, you're less likely to contract it. If you're vaccinated, you're less likely to spread it to a loved one. If you're vaccinated, you're less likely to be hospitalized. If you're vaccinated, you're overwhelmingly less likely to die. And after over 550 million doses, no matter how many small, occasional, rare moments there have been of a side effect that's been significant, it is so exceedingly small compared to, again, the nearly 18 million people who have died from COVID to date when you look at the projection. So where are we right now? Well, we're not where we need to be. When we take a look at those people who reside in districts 1 through district 7, only about 37% of people have received 2 doses, and just a little over 12% have received 3 doses. We haven't seen enough people get vaccinated to protect themselves and to protect their loved ones. And that's really our focus. We have more than enough vaccine. There are many, many places to receive it on a daily basis. There are no barriers here. As Governor said, there's even some incentives here through the end of the month. But the biggest incentive is to save your life, to save the life of your loved ones. And we do need people to be vaccinated. Even now, when we're between storms, so to speak, is the time. We certainly are concerned about vaccination rates on a global level, but we are also concerned about the vaccination rate here. And so again, if we're going to examine COVID, we have to do so in a frank manner. Many, many things have gone right for us. But if I have a lesson learned through this, it's that we still need to continue to teach, educate, and listen to people who don't want to be vaccinated and continue to teach them at least what we know, give them the facts, let them see the community's data so that they can make an informed decision.